District Administration. Explore your history. Explore your land. Explore your sister islands. And Cayman Airways. Call them on 949-2311 to book your nonstop flights to Los Angeles and Panama. And now, Barbados. And Digicel, Cayman's bigger, better network. And Doctors Hospital. Peace of mind is important when life happens. Doctors Hospital. Always there for you. Call 949-6066.
But I do have some questions.
There are more questions than answers.
Cayman Islands' foremost listeners participation program.
Talk today.
What is on your mind, Cayman? If you are ready to talk, we are ready to listen. Here's your host, Sterling Dwayne Ebanks.
Hey, welcome. Thank you so much for joining us on a really terrific Thursday edition of Talk Today, as we invite you to share the good thing in partnership with the National Drug Council. 12:30 to 1:30. Good physician and friends over at Doctors Hospital will join us. And then 1:30, well, our friends from Education Ministry has much to share, including what's coming up in relation to school registration and the NCFA. So stay tuned for Talk Today.
Avoid any statements or comments which are abusive, derogatory, malicious, or defamatory. Do not use indecent language or make any statement that is false or misleading. Call 1-800-534-8255, 949-6990, 949-8037, or WhatsApp us on 925-3261.
Email Talk Today at candw.ky. Let your voice be heard.
And now, back to Sterling Dwayne Ebanks, Radio Cayman Talk Today.
Hey, welcome and thanks for joining us. I'm so grateful that teachers would allow students to leave class, and students are like excited to, I'm going to miss class. Well, they're excited because they get to join us in the studio. And as we welcome our studio guests, let's first join via the phone from the National Drug Council, the Prevention and Education Officer, Ms. Delisa Hernandez. Ms. Delisa, good afternoon. How are you?
Good afternoon, Mr. Sterling. I'm well. How are you?
Oh, man, I am blessed. Some would even say beautiful. It's all good. Well, thank you again for helping us facilitate this discussion. And as we go to our guests, perhaps we start with you and share why you're here and set the stage for a discussion.
All right. Thank you so much, Mr. Sterling. And obviously, as always, a pleasure to be on your show. March is the launch of the National Drug Council's National Drug and Alcohol Facts Month campaign. And it's a campaign within the secondary school that aims to educate high school students and raise awareness about the dangers of substance abuse through educational events and activities. And it aims to equip students with factual information about drugs and alcohol so that the teens can make informed decisions. Today we're focusing a little bit more on a demonstration that will be taking place tomorrow in town, starting at the Cayman Academy School. So the Cayman Academy has a youth-to-youth chapter after-school program at their school, and the students decided that they wanted to do an anti-vaping drug march. So they will be doing this visual demonstration tomorrow, starting at the high school, and it'll go through the waterfront and back down through Bayshore Mall and back to their school. And the entire school is going to be participating. And this is what we're going to call an annual kickstart to the campaign, bringing students, educators, parents, community members, anyone who wants to participate, in raising awareness and advocating for teens to make those positive choices when it comes to vaping, alcohol, and any other drugs. That's what we're talking about today.
Awesome, Mr. Delisa. I think I should invite you to be my host so I can go on a year-long sabbatical. But we talk about that later. I'll have my agent speak to yours. Well, as Ms. Delisa shared in the studio from Cayman Academy, Ms. Petellee Jones, the Educational March organizer, and two of our fine students. But to you first, Ms. Jones. Welcome and thanks for sharing with us. How are you?
I am well. Thank you for having us.
It's good when we see not just student leadership, but when that sort of instruction and nurturing is facilitated by the school and by the teachers who take a vested interest. As we talk to what we're going to have in relation to tomorrow. Through you, we want to speak to our students and how you introduce both, Ms. Peyton and Mr. Niel. But share this to you, Ms. Jones.
All right. So as Mrs. Hernandez rightfully said, it is important that we bring awareness to the dangers of drugs and most importantly, vaping. And so tomorrow, March 1st, the Cayman Academy students from years 4 to 11 will be marching from Memorial Drive, Waterfront, Bayshore Mall, and then back to Walker's Road, and then back to Cayman Academy, where we'll be sensitizing the community on shattering the myth on vaping. We want them to know that it's okay to, we can have fun, we can socialize with clean fun, and we can socialize without the influence or the use of drugs or alcohol.
And that's interesting, because sometimes we have a perception, and now the use of vaping is so commonplace, and many people can seem to do it indoors, and there's this beautiful bouquet that we smell and we think, oh, it's harmless.
That is so true, because gone are the days where we would see, the physical cigarette and we will be, standoff about it. But now, because it's a machine that we're using to smoke, we think that it's okay and we can do it just about anywhere. And so that is why it is important that as youth, as young people, we come together to let them know that it is not good and it still has the same impact on the body as a cigarette would.
Okay. Well, through you, perhaps we can invite Miss Hamilton as one of the youth students over at Cayman Academy. How are you, ma'am?
I'm fine, thank you.
Would it be okay? Well, share with us first anything you want to before we ask any questions. What would you like to say to us?
Being a part of the Y2Y program is really fun and educating, because it tells us that we can be anything we want to be and that we don't have to use drugs to show that.
Okay. How do you think, as young people, in particular students, whether they're high school or middle school, they look at vaping, and do you think they see the dangers at a tender age and dismiss it? Do you think they look at it and think, well, it smells good? I mean, cloud of smoke might look good, and they are not fully aware of how potentially dangerous it might be, as opposed to, say, consciously, as Miss Jones said, here's a cigarette in hand, and they, ooh, it's nasty looking, it smells bad, tastes bad. Vaping is more appealing, do you think? No? See, education works. Well, to you, Mr. Facey, how would you respond to that? Do you see that it's easy to tell the young student, what, there are dangers to this, and they take it on board, or do you think they'll dismiss it and check it for themselves?
From what I have listened to from my peers and higher ups, vaping may be more appealing to students compared to cigarettes, as there are different colors and flavors for vaping. So with this, people say, oh, this is so much better, and it will definitely be good for my body. But in vaping, there's a substance called nicotine, and it can damage your body really badly, just like smoking. So with this, I see that vaping is really bad for students all around, because vaping can mainly damage your bodies and can be used as peer pressure for other students.
So you want to fit in and so Ms. Jones, this is where having that education, tell the child, listen, this is probably even more dangerous, but at the very it is dangerous. Don't venture in front of yourself and pay the consequences later. How do we get that instruction to them where they feel that we're helping, as opposed to forcing it on them and compelling them to do it?
One of the ways we try to do that is through the Y2Y Club. And when we meet on Wednesdays at Cayman Academy, we tend to have presentation. Even the very students, they will come, they will do their research and come to inform their peers. So the Y2Y is an avenue in which we can educate them to let them know that, listen, drugs are bad, vaping is bad, alcohol is bad.
Yeah. Ms. Hamilton, if I may ask you then, sometimes we think that as a student, it's too early, the child is too young to be told about this thing. Of course, everything should be age appropriate and, language that they can use. But for things like vaping, do you think, it's too early? What age do you think is too early to start, or the earlier the better, to tell them about the dangers and the like?
I think the earlier the better, so they can know so they can be aware about the consequences of their actions.
All right. If I might then ask Mr. Facey, you talk about peer pressure and that sort of, we all feel in some way. To what extent that peer pressure is so evident in the Cayman community relative to trying vaping or some other drug? Is it really, really a lot of pressure, or is it more just want to fit in and not be pressure?
With how schools are nowadays, it's mainly students wanting to fit in with other groups because, say, Peyton transferred in as a new student. See, a lot of people in their class are vaping. So they didn't really used to do that in their old school. So since they're in a new school, they're trying to fit in. Mm-hmm. So with this, the students in their class will see that and try to get them into vaping, leading to peer pressure.
Okay. Ms. Delisa, do you want to jump into the conversation?
Sure. It's really amazing how these students can articulate the information and be able to present it to the wider community in the Cayman Islands. Mm-hmm. These students have been a part of the Y2Y program for a very long time, and we have been honing their skills and leadership skills and being able to work with them to be able to have some public speaking opportunities and train them in a way that they're able to elaborate on the things that they've learned within their actual sessions that they have after school. Currently, right now, we are available to do the youth program in other high schools. So if there are listeners out there who are interested in having the youth program in either their elementary establishments or in the high school as well, they can certainly reach out to myself at the NDC. They can email info@ndc.ky. And if you're interested also, your secondary school is interested in participating in the National Drug and Alcohol Facts Month campaign, certainly give us a shout out or send us an email rather to that info@ndc.ky, and we can send you a registration link. It'll be taking place throughout the entire month of March. And if you're wanting to jump on board next year with the annual launch march, we will most definitely be happy to assist with organizing the actual march and going through those pieces as well. Right. So, yeah.
Thanks very much, Mr. Delisa. I know this will be an ongoing discussion as we've had with your team. But to Ms. Jones, the actual sort of logistics of tomorrow, if you just remind us as we close today's discussion.
Sure. So we meet tomorrow at Cayman Academy. We're expecting to start the march at 8 a.m. And we want to go, as I mentioned before, the route is Memorial Drive, Waterfront, Bayshore Mall, Walkers Road, and then we're going to end at the King Seventh-day Adventist Church. That should take us roughly to 8:45. And then at 9 a.m., we're going to have a information session. We're going to have Mr. Simon Miller from the National Drug Council, who will be our guest speaker, further educating the students on the dangers of alcohol abuse and vaping.
Okay. Got one other question for both students, if I might, to you first, Mr. Facey. With the information that you receive as part of being youth to youth, how do you share that, to your other classmates and wider friends, either at school or otherwise, or even at home? You receive the information. How does that help you in talking to them about the dangers of vaping?
From what I've learned from the higher ups, vaping has a lot of dangers on the body, like I said before. So I know a lot of people nowadays say, I don't want to die young. So we could take that and say to them, if you vape at this early of an age, especially when your body wouldn't be as strong as in full-grown adults, if they're vaping, they would take into consideration that maybe by vaping at this early of an age, it would damage my body. So taking vaping now will damage their body, so that we can see maybe we don't want to do vaping at this age, so they can contribute that to others.
Yeah. And to you, Ms. Hamilton, we talked about it's never too early to talk to children about good information. When we share that information, two parts to the question. Do you think the child, would hear it take it on board more from the parent, the teacher, or their fellow classmate?
I think they would take it on more by their fellow peers, the classmates, because the classmates are their age and they're just trying to be like talking to them like normal.
Right. Very key. Well, Ms. Jones, thanks for coming on. Any closing thoughts from you?
We're just appealing to the other high schools, the other persons out there to come on board, because as Ms. Hernandez rightfully said, it's going to be an annual march.
All right.
So come on board and come and support us tomorrow morning.
Thank you all for coming and joining us today. And I pray the march, not only safe and successful, but all the other students will do, across the Cayman, join and understand the importance of looking after their health and well-being. Ms. Hernandez, thank you, Mom. Quick final words from you, Mom? Okay. Sorry. Yeah. Okay. Well, technology works, Great master and bad servant? No. Never, ever, ever. Thanks very much to you, Ms. Jones, for bringing along the students. And truly, looking forward to not only being an annual march, but a daily, instructive, positive, nurturing way to making the students healthy.
Thank you so much.
All right. To our listeners, please rejoin us after the break as we focus on healthcare with the friends and physicians over at Doctors Hospital.
From boat days to beach gatherings, leave the catering to Subway. Choose from small and large sandwich platters, double meat wrap platters, and top it off with optional cookie platters for dessert. Or ask about our Subway box to go with the option of 6-inch or foot-long sandwich, 1 cookie, and 1 bag of chips. For all occasions and celebrations, let Subway focus on the food so you can focus on the fun. Visit subway.ky for catering options. Subway. Eat fresh.
At Doctors Hospital, we know life happens, and usually when you least expect it. So when unexpected medical issues arise, you need quality care close to home. Located in the heart of Georgetown, our accomplished team of physicians and medical staff treat minor urgent conditions such as migraines, chest and abdominal pain, shortness of breath, burns, broken bones, open wounds, and more. 24 hours, 7 days a week with no appointment necessary. Peace of mind is important when life happens. At Doctors Hospital, we're always here just for you. Need to speak to someone? Call 949-6066.
You know, as a little girl, I dreamt of traveling to faraway places and foreign lands. I tell you what though, no more dreaming. I'm going flying with Cayman Airways. How blessed are we in the Cayman Islands to have a very own national airline? Girl, you can fly to so many international destinations without the hassle of connecting flights. On top of Jamaica, Cuba, and Honduras, you got non-stop flights from Cayman to New York, Miami, Tampa, and even Denver, Los Angeles, Panama, and child, they now have Barbados. Going to be a little cafe con leche and Hollywood Squares for this old girl.
Make your travel dreams come true with Cayman Airways, offering non-stop flights for non-stop adventures in Panama, LA, and many more places in between. For details and to book, call 949-2311, contact a travel agent, or visit CaymanAirways.com.
Find your dream car with a Cayman National Vehicle Loan. Enjoy 100% financing, up to 8-year repayment, and a 7% fixed interest rate for the first 5 years. For eco-friendly cars, we'll waive your commitment fee. This only applies to new vehicles. Call 949-8300 or email lending@caymannational.com today.
Ladies and gentlemen, have you heard the news? Digicel is back with exciting offers that are too good to resist. Activate one of our brand new prepaid or postpaid plans today and experience telecommunications like never before. With more data, dedicated entertainment options like Netflix, YouTube, Spotify, and endless social text data for all your favorite platforms. Digicel is here to make sure you stay connected and entertained. Whether you are on a prepaid or postpaid, you will also enjoy dedicated roaming data for the USA, Canada, and the Caribbean. It's all about value, and Digicel has got you covered.
Wouldn't it have been grand if you had purchased land 30 years ago? It may not be 2020, but a perfect vision has never been more clear. Cayman Brac and Little Cayman, poised for growth with an eye on the future. Your land, your history, your future. Discover all that our sister islands have to offer.
Radio Cayman's Talk Today. What is on your mind, Cayman?
Hey, welcome back, and thank you very much for joining us. And not only do we have an opportunity to showcase the incredibly growing talent that we have in the community, but to remind the listeners that sometimes the commute for extra health care is just across the street, not necessarily across the pond. So Cayman continue to expand the wonderful resources that we have. Well, our friends over at Doctor's Hospital joins us, and its medical director, Dr. Richard Preece. Thanks for bringing along a fantastic team. Some faces are familiar, and as the community gets more and more acquainted, I think Dr. Ebanks and some of their team, you see a growing complement. So excited. Welcome, sir.
Thank you. I mean, it's a pleasure to be here again, and as you say, we're an amazing team of surgeons. Mm-hmm. We're very fortunate to be able to bring in some really talented people at Doctor's Hospital, either into the hospital directly or to work with them, as we do with Dr. Ebanks and Dr. Dancey. And what that means is that we gradually build a better and better team that makes this great care offer to Cayman. And that's something that I'm really proud of. A lot of that work was done before I arrived last year. But my job is to make sure that we've got the right people doing the best things, that we're bringing in innovation, new services, and expanding the care that residents can get here in Cayman. And I think a key part of my job is to make sure that, I'm the voice for patients, because when patients are, seeking surgical intervention, they've not necessarily got that much knowledge. My job is to make sure that, what they're getting is what they expect, so that we're really putting in the governance to give them really good outcomes, best we can at all times.
And for me, I'm honoured because, and I don't say this lightly, and I certainly don't say it to be, inflammatory, but just genuinely proud. As a patient, as a prospective patient in the Cayman community, whether, I'm visiting in need of health care or whether I've been here working and living for decades, to know that if necessary, you have the resource that could be right around the corner, just down the street. And we take it for granted sometimes, but in a small community, to have it, we should celebrate it. So thanks again.
Definitely. And for me, it's been a privilege to join what is a very well-known Caymanian institution.
Mm-hmm.
It was set up by Dr. Tomlinson, a Caymanian. Our chief of surgery is Caymanian. We've got a diverse group of surgeons been able to bring together to work with us. But it feels like a Caymanian family that I've been lucky enough to join, and we need to continue the legacy that we've got into the future and continue to build for the people that want to use the hospital.
Right. Well, if I might, I'm always willing to learn, and for some people they didn't like school. I enjoyed it because I come away with something with deference to the rest of us. If I could maybe first start with Dr. Tanja Ebanks. Good afternoon, how are you?
Good afternoon, I'm good. How are you?
I love to hear.
For inviting me again.
No, thank you for coming along, because what I'm hoping for, and I'll be guided by you, and I certainly appreciate your continued support and sponsorship of Radio Cayman and the appearances, but I'm hoping that as a community we'll come away with two things. Very cognizant and confident of what is available here, but through your presence may encourage many of our students and their parents to look at healthcare and see the varied facets that are there, whether they want to get into the physical practicing or whether they want to get into administration or the support services. And they can pursue these careers and do so with great reward, financial and fulfillment personally, without having to travel overseas but for studies. And to me, that's a testament to a true growth for our country. So tell us, if you might, Dr. Ebanks, tell us a little bit about yourself.
I'm born and raised in Switzerland, and I'm a general surgeon. I have a special interest in breast surgery, varicose veins and hands. I do a bit of general surgery as well. I joined Doctors Hospital in 2006, and I was there until 21. And I opened up my own practice in Governor Square. I still mainly operate at Doctors Hospital for all the surgeries that need general anesthesia or sedation. And I have Dr. Dancey, who joined me in 2022, August. She's a plastic surgeon, which complements what I'm doing with the breast surgery. And then we also have a sonographer now in the practice. So we're doing breast biopsies there. So I have been lucky enough to have Doctors Hospital and the Breast Cancer Foundation buying and getting a PDE, which is one of the equipment I wanted to talk to you about.
Yes.
It's a new equipment we have probably for about a year now. And we use it for sentinel lymph nodes, which is lymph node biopsies when you have breast cancer, mostly in the axilla. And it helps us as a dual tracer. It has a second option of imaging what we need to take out. And it's PDE stands for photodynamic eye. It's a camera which can real life take pictures of a dye, which is fluorescent green dye that we inject. And then it goes into the armpit and it shows us with the camera where is the lymph node that we need to take out. And we also use it for lymph node transfers, as Dr. Dancey will talk about later. And we also use it to check for lymph node, after the lymph nodes have been removed, lymphedema. So we do follow up the patients who did have surgery from breast cancer to make sure that if they start to develop lymphedema, we're going to look after it early.
And this is sometimes we hear and commend the Lions Club of Tropic Gardens in particular with their breast cancer awareness initiatives and early detection is important. Let me confirm with the boss across the street, Ms. Susan. Do we talk to the floor or we got to take a break now? Boy, he follows instructions. He keeps stringing. All right, we're going to come back. We'll start back with Dr. Dancey, if we might, and then Dr. Felix after. Please stay tuned for Talk Today.
You know, as a little girl, I dreamt of traveling to faraway places and foreign lands. I tell you what though, no more dreaming. I'm going flying with Cayman Airways. How blessed are we in the Cayman Islands to have a very own national airline? Girl, you can fly to so many international destinations without the hassle of connecting flights. On top of Jamaica, Cuba, and Honduras, you got non-stop flights from Cayman to New York, Miami, Tampa, and even Denver, Los Angeles, Panama, and child, they now have Barbados. Going to be a little cafe con leche and Hollywood Squares for this old girl.
Make your travel dreams come true with Cayman Airways, offering non-stop flights for non-stop adventures in Panama, LA, and many more places in between. For details and to book, call 949-2311, contact a travel agent, or visit CaymanAirways.com.
Ladies and gentlemen, have you heard the news? Digicel is back with exciting offers that are too good to resist. Activate one of our brand new prepaid or postpaid plans today and experience telecommunications like never before with more data, dedicated entertainment options like Netflix, YouTube, Spotify, and endless social text data for all your favorite platforms. Digicel is here to make sure you stay connected and entertained. Whether you are on a prepaid or postpaid, you will also enjoy dedicated roaming data for the USA, Canada, and the Caribbean. It's all about value, and Digicel has got you covered.
Discover your dream home with Cayman National's home loan. Get up to 95% financing, repayment up to 40 years, and just a 0.5% commitment fee. Your interest rate? Depending on your risk factors, it'll be fixed or variable. Plus, you get a pre-approved credit card. This is a limited time offer. Dial 949-8300 or email lending@caymannational.com today.
At Doctors Hospital, we know life happens, and usually when you least expect it. So when unexpected medical issues arise, you need quality care close to home. Located in the heart of Georgetown, our accomplished team of physicians and medical staff treat minor urgent conditions such as migraines, chest and abdominal pain, shortness of breath, burns, broken bones, open wounds, and more. 24 hours, 7 days a week with no appointment necessary. Peace of mind is important when life happens. At Doctors Hospital, we're always here just for you. Need to speak to someone? Call 949-6066.
Radio Cayman's Talk Today. What is on your mind, Cayman?
Hey, welcome back, and thanks for joining us. And from Doctors Hospital, we got a chance to share not only with new and expanded things, but a reminder of what we have. So, from their medical director through their surgeons, it's great. As we were just chatting to Dr. Ebanks, now we ask Dr. Dancey to share with us. Welcome. It's a pleasure to have a chance to chat with you, and through you, not just become excited, but maybe enthused enough that our students would consider careers in medicine and even particular specialties. So tell us a little bit about yourself, Dr. Dancey.
So it's a pleasure to meet you, and thanks for inviting us. So my name's Dancey. I'm a plastic surgeon who used to live in England up until 4 years ago. And then COVID happened and we weren't able to operate. And actually, in many ways, COVID changed the world, but it changed my life too, because I realised that Cayman was open and that I could come here. So I got an amazing opportunity for 6 months to work here and offer some plastic reconstructions which hadn't been available before. And then after a year of going backwards and forwards, I thought, what am I doing? I love Cayman. I don't want to be in England. I'd much rather be out here, working with my colleagues here. And it's an immensely rewarding job. And setting up a plastic surgery service has been a challenge, but it's got huge benefits. So it's an absolute pleasure to be on the island and able to offer these services.
As I listen to you, there are two things that are immediate. One, the fact that we have resources, but two, the way Cayman's community can have a global reach, and that, in fact, transpires into something that is beneficial to us. Well, maybe a good way to invite Dr. Felix into. How are you?
I'm fine, thanks. How are you doing?
Oh, look at me, man. Any better, I'll be my father. Yeah. It's just good. Maybe one day. Dr. Omar Felix, as a general surgeon, and I'm told specifically oncology, right? Tell us about yourself and share with us.
Yes, well, good afternoon, everyone. Thanks for having me. I'm Omar Felix. I was born in Jamaica, born and raised. I did medical school in Jamaica, and I did training in surgery in New York and also in Toronto. I've been on Ireland since about 2016, 2017. I was previously in HSA, but I've joined. I'm returning to the island. I've joined the Doctors Hospital. And my focus is mainly on breast surgery and breast cancer surgery specifically.
And when you think of that, sort of not just reconstruction, but we see notable celebrities talking about getting double mastectomies and then the impact, and then there are those who are not just preventative, but they, for whatever reason, didn't get diagnosis early enough. What do you say to that patient who is now potentially speaking to you relative to their diagnosis and the prognosis of being having this sort of surgery? How do you get them to a space where they feel a sense of confidence, but they also understand the importance of what we're going to transpire and the aftercare?
Yeah, so that's, we've understand over time that body image is very important. Mm-hmm. It's a part of quality of life. So as breast surgeons, we try to help the patient maintain their body image without compromising on oncological principles, which means principles of cancer treatment, right? So part of that is we do what's called breast conserving surgery, where we use these oncoplastic techniques, and most times in collaboration with the plastic surgeon, to basically remove the cancer but maintain the cosmetic integrity of the breast and maintain the body image. In cases where the cancer does not allow for you to save the breast, then we do procedures where we remove the breast, but either saving the nipple or saving enough skin that the breast can be reconstructed with the help of the plastic surgeon. So Dr. Dancey would come in, so we collaborate with her on almost all our cases, and she will do the breast reconstruction, which she can touch back on as well, and she also does the lymphatic transfer and stuff that she can also touch on again. But essentially, what we try to instill into patients now is that in bringing the technologies to the island and advanced techniques, that in terms of breast cancer care in specifically, that there's no need to travel off island anymore. Mm-hmm. In the past, Caymanians would have to to travel off island to get the standard of care, international standard of care in general and in breast surgery and breast cancer care. But now we have all the resources on island that you don't need to travel. So that's important for the patient to know that. And part of developing that rapport and that trust with the patient, we can let them know that everything can be done on island, in collaboration with even in other institutions. Because that's also part of what we're trying to do here as well, is to collaborate. Yeah. It is what's best for the patient is if we can utilize all the resources on island. It doesn't matter what institution that it's available at. So for example, for example, radiotherapy is available on island, and that's important in terms of what we do in terms of breast conservation, and that helps that process. And so the patient doesn't have to travel off island to get radiotherapy anymore, or the advanced procedures that we now do between ourselves, Dr. Ebanks, Dr. Dancey, and myself. We do breast procedures that are the standard of care worldwide, and that's available on island.
Yeah. Dr. Ebanks, if I might follow that, the long-standing practicing physician here, as part of the Cayman fabric, you bring your expertise, and that idea of the body image. For many of us, style over substance, you want to ensure that your patients are not just looking up at their health and well-being. How do we, looking at the sort of the surgeries you've done here and what's available, how do we get our patients to that space, as Dr. Felix was sharing? What would be your words to them when they're looking at facing something that is life-threatening and then, ignore it into their detriment?
Yeah, so there usually is two options there is two options when you have breast cancer. One is either you can remove the lump and leave part of the breast tissue, or remove the whole breast. And that not every patient has both options, so we have to do investigations to give them the option. Some of them have both, and the ones who choose to go for breast conservation surgeries, they will have to have radiation afterwards. And Dr. Dancey will also assist with those. Even if she doesn't have to reconstruct the full breast, she will make the shape nicer afterwards. Sometimes when there is a dimple, there is lack of tissue, she will do fat grafting to fill this out in the future. So those are surgeries we have done a lot. And then once you have to remove the breast, what is option that you can get a reconstruction with implants, or you can get reconstruction with your own tissue. And now that Dr. Dancey is here, we are able to get the most up-to-date DF flaps, which she may touch base a little bit.
Dr. Dancey, wonderful segue to speak to your practice and specialty, some of the surgeries that you perform.
Yeah, so certainly in conjunction with both Tanja and Omar, I joined them for the surgery. So the idea of a plastic surgeon is that we restore, we rebuild, and we make whole the parts that God gave but nature took away. So the idea is that when a patient has a lump removed, I can mobilise the breast tissue and move it around to fill a hole. And if they have a full mastectomy, then we've got a range of options to go for the reconstruction. So it's really important that I meet patients early on, really, as soon as they get their diagnosis of breast cancer, so we can establish what type of surgery they want and the best way that will reconstruct them, because it's all tailor-made to the patient. There are often lots of options, and they're going to have a preference. So what I do is I'm very much there to rebuild things. They have to have the cancer surgery, unfortunately, but I want to get them back as good as possible to what they used to be before surgery, and sometimes hopefully even better if they weren't happy with their appearance before surgery. So my bit's kind of rewarding, because it's the end of their surgery. Once it's completed, they can kind of draw a line under it and hopefully move on without a daily reminder that they've had a mastectomy or that they've had breast tissue removed.
Would this, sort of when you come into it, would this be while the patient is then and there undergoing, so they don't need to come back, it's done then?
So there's two options with reconstruction. So the first is that I join the breast surgeons when they remove the breast tissue. I'm there so that they wake up with a breast, they never have to go through not having a breast. But that's not always suitable for all patients. If they need radiotherapy, that might change the timings of when I do things. And also there's patients who've already had mastectomies down the line and now they're coming because they want something done about it. So it can be done either way, and I think it's really important I meet with them early on in their procedure so that we discuss these things and these options to find out what they prefer and perhaps what's best from an oncological point of view.
Give them peace of mind, but guide them in what to expect.
Yeah.
So that.
So my job's really to guide them as to what's possible and then to take on board their requests and wishes. So I've got more flexibility in that than the breast surgeons because they know what they need to do from an oncological point of view.
Okay. When we come back from a news break, if we could ask, through you, Dr. Preece, the idea of, what's available, how do we navigate that, how do we access it? And then if the physicians, as sort of the surgeons, could maybe speak to some of the procedures you've done, highlight some of the things that have intrigued, so that, to Dr. Felix's perspective, get the populace appreciative of what is available here that they did not realize, used to be. All right. Ms. Susan is ordering chocolate. Anybody got preferences? All right. 949-8037 or 949-6990. Our physicians have offered an opportunity, later on in the program before they leave at 1:30 to take some questions if people having a particular concerns. It's always good to be able to get information and instruction. And then as we shared at 1:30, at the end of the segment, we'll get a chance to chat to our education specialist. So stay tuned for Talk Today.
Radio Cayman, maintaining the innovation.
On a daily basis, making it easy to connect with you, our listeners. Add us to WhatsApp today, 925-3261. That's 925-3261.
Radio Cayman.
Send a text or voice note.
Message us at 925-3261 on WhatsApp today and get active with Radio Cayman.
Radio Cayman, the voice of the Cayman Islands.
Radio Cayman, maintaining the innovation.
Information, entertainment, inspiration.
Covering Grand Cayman, Little Cayman, Cayman Bright.
Since 1976 till now.
Radio Cayman in the Cayman Islands.
From Radio Cayman's newsroom, this is Headlines.
Local, regional, international news.
According to the Economics and Statistics Office, the Consumer Price Index for 2023 jumped 3.8%, blamed on higher prices for everything from household furnishings and equipment, food and beverages, to housing and utilities. You can find the full fourth quarter Cayman Islands Consumer Price Index report online at eso.ky. Good afternoon, I'm Dion Anglin with your headlines. In news elsewhere, Gaza's Hamas-run health ministry says the number of people killed as they waited to receive aid has risen to 112. Spokesperson Dr. Ashraf Al-Qudra adds that 760 people were injured. He says that according to witnesses, the bodies of some victims are yet to be recovered from the Nabosi roundabout on the southwestern edge of Gaza City, suggesting the number of casualties could rise further. And baseball superstar Shohei Ohtani, one of Japan's most eligible bachelors, has announced that he is married, stirring a frenzy on social media. The Los Angeles Dodgers star's announcement came as a shock, as he has closely guarded his private life. The 29-year-old said today in an Instagram post, "I wanted everyone to know I am now married." Ohtani described his Japanese bride as someone who is very special to him, but he did not disclose her identity. That's a wrap of your headlines. I'm Dion Anglin.
More news available at www.radiocayman.gov.ky. Check out our social media pages: Facebook, YouTube, X, formerly Twitter, Radio Cayman Headline News.
HSA's Urgent Care Clinic is now open 7 days per week to serve you better. Visit our dedicated team at Urgent Care Monday to Friday, 8 a.m. to 8 p.m. and weekends and public holidays, 11 a.m. to 8 p.m. No appointment necessary. If you are experiencing non-life-threatening symptoms and conditions such as the cold and flu, sprains and cuts, earaches, nausea and vomiting, visit Urgent Care's walk-in clinic at the main entrance of the Georgetown Hospital, now open every day. At HSA, we are committed to caring for you.
Radio Cayman is pleased to feature this special Sister Islands historical vignette brought to you by the Ministry of District Administration and Lands. Explore your history, explore your land, explore your Sister Islands.
Captain Livingston Anderson, 1873-1944.
Captain Anderson was a well-known and successful ship owner and sea captain, one of the only black ship owners and master mariners in Cayman at the time. He owned the sloop Panama in the early 1900s and piled a regular cargo trade between Panama and San Blas Islands. He also raised cattle, ran a plantation, and raised horses for rental. He was well respected by all business owners in Cayman, a pioneer for black business ownership at the time when business ownership was heavily skewed along racial lines. He was married to the former Catherine L.V. Mackenzie, and the couple had 5 children.
Radio Cayman is pleased to feature this special Sister Islands historical vignette brought to you by the Ministry of District Administration and Lands. Explore your history, explore your land, explore your Sister Islands.
Explore your history, explore your land, explore your Sister Islands, the ultimate staycation experience. Your culture, your freedom, the land that time forgot isn't gone. It's your Sister Islands.
Discover all that our Sister Islands have to offer.
Radio Cayman's Talk Today. What is on your mind, Cayman?
Hey, welcome back, and thanks very much for joining us. I mean, today to have the initial discussion, albeit only an abbreviated one, with our students as they talk about the upcoming March and the programs of the youth to youth. But now to focus on healthcare, two of our pillars in our society, and our friends over at Doctors Hospital. It's hard sometimes, Dr. Preece, to look at Preece. See that, Susan? Almost got it right the first time. Dr. Preece, Dr. Richard Preece. To look at a small community sometimes and to see it either from the size of its population or its physical geography. Wow, how can such great resources exist within such a small space? Yeah, I'm thankful for 2 reasons. I look in the mirror and go, see, great things do come in small packages. But secondly, I know Dr. Felix is like, yeah, thank you, man. But for this community, it not only serves for those of us who live and work here, or those of us who visit, but even for the surrounding region, just like how some may travel elsewhere for education or healthcare. We could be in that space. So to you and your team, as you look at just 3 of your colleagues here, it must be a rewarding job.
I love the job. I mean, for me, I came from a very big medical director job with 40 hospitals in the UK, and I wanted to do something new and challenging, and here I am in this amazing environment, which I love. And it is about our ability to attract talent. How do we get the best people? How do we continually refresh that? And I look across the physician numbers that we've got at Doctors Hospital, and they're from every continent, and from all around the Caribbean, Nevis, Trinidad, Barbados, Bahamas, Jamaica. I mean, it's just amazing, as well as, of course, Europe and North America, and to be able to attract those people is not just about being a great hospital, it's also about being in a great community, a really great setting. And we're very fortunate to be able to do that. And my job is to make sure that we bring those people in. We look for gaps in healthcare and then seek to fill them, that we look at the people who are coming towards the end of their career and make sure we've got new talent coming along that they can nurture for the future. So for me, it's just been a really amazing few months settling into my new role, but building for an even better system of healthcare in the future. And one of the things that I'm personally really proud of is the work that we've been doing with young people. We've got a new nursing assistant has arrived who was born at Doctors Hospital, and as of about 10 days' time, I've got a medical student coming in who's it's a medical school in England but Caymanian, and born at Doctors Hospital. That's the long-term plan. It has to be to build our own talent right from the ground up. So really exciting time for me actually at the moment.
Thank you for highlighting that. That's kind of why, as I tried to allude with Dr. Ebanks' presence, I mean, she's, some would say maybe one of the best countries, but for Cayman back. She comes from. Nobody's going to argue with that. I mean, the BRAC is the BRAC, right? But having that connection, having that familiarity, having that competence as you look around your colleagues, either in your premises or just the wider community, those continued education, those conferences that you sometimes not only are you required to attend in order to maintain your licensing, but you want that nurturing, you want that ability to sharpen your skills. And talk to us about some of the things that you're able to do here, some of the surgeries that you have perhaps performed, as much as you can. Likewise with Dr. Dancey, because the community needs to be aware of some of the cutting edge things that are happening, the things that can be done that we didn't realize have been and are being performed right here.
Yeah, so I can pretty much do everything I was doing back home when I left 18 years ago and more, which has developed with Doctors Hospital and sponsorships from different organizations. So for the breast surgery, as you were already asking before, we can really do pretty much everything on island now. We do have that PDE that I was talking about before, which is helping us with the lymph node surgery. So worldwide, we use mostly radioactive dye. In Cayman, we use the photodynamic eye, but the two of them comprehend the blue dye that we're using. So, which is the gold standard in anywhere around the world. A lot of places do not have dual tracer; they just have the blue dye. So that's exciting.
And that's the thing. We hear oftentimes either in the private or the public sector, the world standards. We're benchmarking against something. We want best practices. It's good to be able to have that as a goal, but it's better when you actually can realize it, and this is the norm. Mm-hmm. So to our community, we no longer need to just look elsewhere. We can look right within.
And one thing as well, since COVID even more so, what patients realize is that we are very quick in seeing patients. Yeah. It's normal, pretty much. You have a mammogram which is abnormal or an ultrasound. You get your biopsy within a week, the reports within another week. You get your MRI, you may be on the table within 3-4 weeks, which in Canada, in UK, many other developed countries, it's not like that. And like how it was in 2019 and before, especially local patients, but generally patients, expats, they were thinking, oh, maybe overseas it's better. And now they have come and realized, and I have more and more patients who come and actually say that as well and appreciate. I can't believe I'm already doing this in the UK. I would still be waiting for my biopsy and things like that, which is amazing.
And thanks for emphasizing that. That's not just a soft nor a hard sell here. It's a unfortunate reality for some of us that we still maintain a perception, like with anything. If it's, comes from elsewhere, it must be better and not appreciative. But Dr. Dancey, compliment what Dr. Ebanks was sharing. You were practicing there. You shared, if you get a chance to come to Cayman where you can actually work. There are two parts to what I'm thinking. One is still, as a world, we're not probably appreciative of the impact that, and I say this with the greatest of intent, to encourage people to consider long-term consequences of what I term, everybody's under house arrest. From the individual to the practicing physician, our activities were severely restricted for an abbreviated time. And the healthcare impact, both physical and mental, may still be untold. So with you being able to come here and practice, and then with you continuing, what sort of things have you seen that have been beneficial, things that have perhaps been a bit of an eye-opener, and what have you shared that has been sort of groundbreaking?
Well, I think I'm very fortunate to specialise in breast reconstruction, but also in lymph node surgery. And there's not many surgeons that do the specialist type of reconstructions that I do. So now we're able to offer them in the Cayman Islands. And when I was in the UK, I was one of the few surgeons that do lymph node transfers for lymphedema. So being able to offer it in the Caribbean is an amazing thing, because there's not many surgeons in the world doing it and able to offer this surgery. And it's life-changing for patients with lymphedema. So actually, we're starting, thanks to the Doctors Hospital and the Breast Cancers Foundation, we've got this PDE camera which enables me to do these surgeries. So I can take lymphatics from a donor limb and using the camera, make sure they're the lymphatics that don't supply the limb, so it doesn't cause you any problems in that limb. And I take them on their blood vessels, and I can replumb them into where lymph nodes are missing. So it allows them to drain the fluid from the arm and also fight infections. And we use a microscope to do it. So I'm fortunate enough to have a microscope here, because the vessels that we're reattaching are less than 0.5 millimetre in size, and they need 12 to 15 stitches around them. So it's really fine work. And when I first came here, there wasn't an appropriate camera to do it, microscope to do it. So, thank goodness we've been able to get this in, and the Doctors Hospital have provided it for me. So now we can offer cutting-edge surgery in a small island like Cayman that isn't available readily in England or in any other country in the world. So, it's amazing that we're able to offer it here. And then with the expertise from the other surgeons and doctors on the island, we can offer everything really that you would be able to get elsewhere. But as Tanja said, in a timely fashion, in the UK, you'd be waiting 3 years on my waiting list before you got surgery. And here we can do it within a couple of months at the most.
Yeah. I want to come back to you on two things you shared, but if I might bring Dr. Felix back into the discussion. Sometimes we'll often hear, small axe fall big tree, but sometimes we see a small place, and even though we see not just the importance but the competence, but we don't celebrate it within the space, but also the surrounding spaces may look at it with instead of a complimentary, they may look at it a bit more circumspect. Your training and expertise, whether in the region or in North America, how do we take that? Being planted in Cayman now, our bread is buttered here, that we can celebrate, showcase it, and ensure that we're the beacon as opposed to maybe being maligned.
Yeah, as you said, small axe fall big tree, but we also say in Jamaica, little but talawa, right?
Yeah, but in Cayman we say small. Okay, go ahead.
Right. There's also little but talawa. So meaning, even though Cayman is small, like you said, there is a lot of expertise here from we have surgeons from Europe, from North America, from the Caribbean, even from Cayman, and that's been trained abroad. They bring the expertise back here. And just to touch on what Dr. Ebanks said, we can offer, in addition to we offer here in Cayman, we can offer personalized care. Right, when in some of the these other institutions in UK and in North America, you almost feel like you're on an assembly line, right? It's a factory where the patient goes in and they don't feel that personalized care. Here, when you see myself or Dr. Ebanks or Dr. Dancey, you're getting personalized care. We're holding your hand right through the process. We're with the patient through their whole journey, from diagnosis on continued surveillance right through for many years. You don't get that in some of the bigger countries. They have trainees. They have they're very busy we're busy here, but they don't have the time to spend an hour talking with you. They're like 10 minutes, you're out. And that goes a long way. In terms of building the rapport, building the trust, and getting that personalized care. So that's very important, and that's one thing you get from a small community,
right?
Without compromise on what you get, because we have the high standards and the resources.
Yeah. Do you think that it helps both the patient from that sort of personal concierge, attentive care, as well as the physician who can spend more time, not feel, from what you shared, my words, feel pressure. You have patient 1 at this time, then patient 2, then patient 3, then by the end of the year, you may have had a large volume, but what is that delivered? Does it help the physician?
So quality of care is sometimes more important than quantity, right?
Mm-hmm.
So you can do 1,000 cases, right? Patients, surgeries, and the quality of the care is not where it should be. And we've all been trained abroad, so we have that volume. We've all been trained with. So it's not that we are not fully trained. We've trained in that setting where we have a high volume. And we're all in a point in our careers where we can give that personalized care.
Which is about what you wanted to begin with, right?
Yeah, which is, then the patients appreciate that. All my patients have my cellular number. They can call me at any time, text me at any time, and you don't get that in other places. And that's important. So I think.
Yeah. If I may then ask, with follow-up from what you shared, given the quality of care, is it then that from the physician's perspective, as Dr. Preece shared, you have colleagues in Grand Cayman that are from all the Caribbean, parts of Europe and North America? You have this wonderful mix, not unlike being in medical school where you have everybody. Would that, in my mind, significantly complement and sharpen your skills because you have?
Definitely, because there's many ways to approach a situation.
Yeah.
So we're always learning from each other. Another thing is that we collaborate on cases. We've started a multidisciplinary tumor board at the hospital just recently, which incorporates all of the surgeons, plastic surgeons, pathologists, oncologists, radiation, which is another tenet of being maintaining that international standard of care, where we are collaborating on every cancer case. Any cancer diagnosis is discussed amongst all the surgeons, oncologists, radiologists, and there's a collaboration and a joint decision on the best steps forward. And also, like in any case, you have two fully trained surgeons assisting each other, as opposed to one surgeon with a trainee or just an assistant. So you have two fully trained surgeons assisting each other.
Right.
So you're definitely getting care that you don't get in a lot of places.
And thanks, because that was sort of leading into where I wanted to ask as well from the patient care. If I'm hearing you correctly, the patient may see just one physician, but now benefits from your, say, oncologist board, your tumor board, benefiting from a collaborative approach. The patient getting the benefit of multiple people from multiple perspectives, speaking to one individual, and as opposed to larger places where maybe silos. How then do we leverage that so that the wider community, the region, and globally see it not from the perspective as a marketing, say, of medical tourism, but from the perspective that we in the Caribbean may go to Europe and North America for treatment, but attract those places, because increasingly, as was said here, I'm hearing whether you're in Canada or the UK, you will get competent care, but it may be 18 months out, as opposed to in Cayman, the same caliber in a world standard care, but it may be 18 days, probably be 5 days in some cases. Very, very quick turnaround.
Very quick. So there is a opportunity and a role for health tourism here in Cayman. It's a wonderful place to recover, and you're gonna get the same standard of care that you would get in North America. And we're actually in the process of trying to organizing and establishing some relationships with the University of Toronto for patients that are waiting too long to come here. And we've made connections with Dr. Dancey and with some of my colleagues in Toronto to facilitate that. Patients will come down here, have the surgery here, and recover here, and then can go back. And also possibly surgeons from Canada that need to operate on their patients there can come down, and we either can assist them or they can assist us, and we can build that relationship with world-class institutions, and that would help build the institutions here and the general care in Cayman.
See, those of us who consciously know and appreciate, and medical tourism is a term that's bantered, but I try to avoid it because I think it has a particular connotation. But Dr. Preece, from your perspective, last time we were here.
The key thing is that we're bringing in the skills to serve the population here. But to maintain those skills and develop them, it's sometimes handy to bring in some extra patients so that we keep the numbers up. If surgeons aren't able to do some volume of activity over the course of the year, then there is a risk they'll be de-skilled. So we want to make sure that surgeons are doing it enough, but also that we're able to do all the types of surgery, with the people with the right skill set. So if there's a procedure that's needed, which isn't done commonly in the Cayman Islands, then there's a lot of sense in bringing in a visiting surgeon to offer that periodically, and that's a very important part of what we do as well, so that the patient can convalesce at home, they don't have to travel, and actually by offering that service through the hospital on a periodic basis, we can give the people the surgery that's safe and effective for them from people who are doing it all the time.
If I might ask, 'cause sometimes, back to Dr. Dancey, you were sharing, sometimes I speak to my female friends, they rather see a female physician. Sometimes they prefer a male physician for different reasons. And I'm always on a personal level wondering if the patient is speaking to a physician of the same gender, would they be able to have an easy rapport? Will the physician then have a particular lens which they can see and then relate to the patient?
Yeah, I think it's a very interesting question because it's something that patients say all the time. It's like, thank goodness you're female. I feel it's easier to talk to you. And I guess I understand that completely. I mean, if I had female problems, I probably wouldn't be going to a male surgeon if I had the option of a female one. So I'm privileged to be able to get a good rapport with patients where they feel comfortable and it's less threatening for them. So I think from that point of view, I mean, clearly male and female surgeons, they're going to have the same skills and the same, but it's how patients relate to them really. And I think, I have the advantage of being female from that point of view. And I, in England, saw the same thing in that I tended to be busier for certain things than my male colleagues, just by virtue of the fact that I'm female and there weren't very many female plastic surgeons. So I think it's true. I don't think it's always a female. There are obviously a lot of patients that feel comfortable with a male and a lot of men that might not feel comfortable with a female surgeon. But genuinely, I think if you've got enough surgeons that you can offer a patient someone that they'll have a better rapport with, then they should always go with that surgeon, because it's not a surgeon telling you what to do, it's a partnership. And I very much believe that I work with the patient to get hopefully where they want to be, but it's both of us and combined decision making rather than just a paternalistic, this is what you're doing because this is what I do and this is what I say you need. And particularly with plastics, because our speciality is a lot more subjective than general surgery in many ways. If you go to a general surgeon and they take your appendix out and they fix your problem, that's that. If you see a plastic surgeon, the English saying is there's many ways to skin a cat, or Tanja says many roads lead to Rome. But, there's lots of different ways that we can approach certain problems, and the way that we choose has got to be suited to that patient.
Even though you may be doing the same thing in terms of that, what do we get for this patient so that if I might just say when she comes out, she's not only treated and can move on with the health of life, but when she looks at it from Dr. Felix's perspective, that body image, she feels confident, comfortable, and she has that growing sense that she's back to 100.
Well, that's true. And I mean, even if you do a surgery and you fix the problem, if you don't make it look right and the patient doesn't feel that they can go out and about without feeling self-conscious, you haven't really done them a service. And I think for plastics, I'm lucky because reconstruction and cosmetic side of things are combined. So when you talk about function, it's not only does the bit work, does it recreate fix the skin where there was a hole, but actually does the person feel like it's part of them and that they don't look abnormal or deformed in any way. And they're both really important.
Dr. Ebanks, with that, there are times when I would imagine the patient, she understands what has transpired, she understands the prognosis and what, but if she's in and you and Dr. Dancey are there, you have this chance to give her that sense of purpose again, reminder that she's still, how do we get her to not ignore those early days and get those initial checks, to catch anything in its early stages and not wait, as we're told that our women in our lives tend to do. They wait till way down the road until it's at an advanced stage. Can we get them to get to you guys a little bit more sooner? How do we make that appeal? It's the early detection. You know?
So we are promoting to do self-exams, and we hope that October, when the breast cancer month is around, that they go and do their checks and get their vouchers for the ones who don't have insurance for it. And just not to ignore anything. A lot of patients always, I can honestly tell them, the one patients that come and they are advanced are usually the ones who kind of knew something wasn't right and they were not really coming right away. There is very rare that it's so aggressive that it's just going to come in with a vengeance, and that by the time you diagnose, it's basically not treatable, not curable, but treatable, as we say. And so most patients, when they do not ignore symptoms and they go for their mammograms and come if there's something, we will be able to give them, even though if they come for a negative, for a bad result, a positive biopsy. Most of them at the end of the time, I can say we are looking at curing, and this is important. I know it's not what you wanted to hear, but very likely because you didn't ignore, because of this and that, we are able to cure you from this, and so that's important.
And thanks for that, because we do ignore it, and as you shared, be encouraged if you pay attention to your early checks. Prevention is better than cure. All right. If I might.
And just one last thing. If you think that you don't have any benefits left, please go to the Cancer Society and ask for help.
Thank you. And I was going to ask, Dr. Felix, from that perspective, because just the word oncology in itself sometimes seems daunting. It just has that feel about it. And for many of us, if we ignore it, we believe it'll go away. Does that work? Ignoring it, will it go away?
Yeah. As Dr. Ebanks said, ignoring it will not cure it. It will only just come present in an advanced stage.
Yeah.
So it's really important to promote the screening and early detection. The care for breast cancer has improved significantly over the last years in terms of the chemotherapies, the immunotherapies, and there are multiple ways of treating the cancer now. And in the past, breast cancer treatment was just a blanket treatment for all types of cancers. Now it's very individualized to that specific cancer and that specific patient. So the survival is significantly better now.
Yeah.
Right, the options for treatment are vast, right, and it's all available here. In terms of the chemotherapy, the immunotherapy, and so the focus now, has moved to the quality of life, because the survival from the breast cancer is significantly improved now. So and the earlier you catch it, the better your chance, the survival is, and actually cure, because if you catch the breast cancer in a very, very early stage, it can be removed by, saving the breast, maintaining the body image, and getting the adjuvant therapies. This is the treatments after surgery, and survival. You can live a very long life after a diagnosis of cancer. So the key is to explain that to the patient, that yes, you have a cancer diagnosis, and it's difficult, and it's hard to hear that and emotional, but we can help you get through it. On a personal note, my mother had breast cancer, which actually that was the reason why I got into breast cancer surgery. I initially wanted to do plastic surgery when I was in medical school, and then my mother got the diagnosis, and then I shifted more to the cancer side, which is why I still try to do what's called oncoplastics, because I still have that kind of attachment to plastic surgery and cosmetic, keeping the cosmesis. So oncoplastics is maintaining the principles of cancer treatment with maintaining the body image, right? Good cosmesis. So it's important to let the patient know that, we're here with them on a journey. It's a bad news that you have this diagnosis now, but there is so much options for treatment now that you can live very long after a diagnosis of breast cancer, and we're here to help you with that.
And thank you all for sharing. I think, Dr. Preece, as you close out the discussion, I'm mindful of what you shared earlier. No longer, if the patient chooses, does that patient have to travel overseas. They can be treated and recover at home, nearer to friends and family. But if you happen to be elsewhere and you come here, the confidence and the competence is also available.
Yeah, absolutely. And what I would say, if there's anybody who's been listening today and and has found a bump, whether that's a woman or a man, we're here to help. If there's a woman who's found something that she's concerned about in the breast, please get in touch with Dr. Felix or Dr. Ebanks. We have our physicians and nurses in urgent care who are there all day, all night, every day. If somebody's worried about anything they've heard, come along and have a word. Contact details are on our website, and we will always help you find the right person to help you. So, people have been listening and are thinking about what we've been discussing. Please do seek support. It's here for you.
Yeah, thanks. And sometimes just knowing that you're still in your space with a familiar person who can relate to where you are that ability in itself may be something that is sobering for you, brings you back to a space.
All the things that the patients in Cayman Islands need are here for them, and we will always help them if they come and talk to us.
Well, thank you all again. Thank you publicly for coming and sharing and reminding the community of where we are and what we have, and to see how great things are here as we look to global standards. We employ them locally. Enjoy the rest of the afternoon, and hoping we'll have some more conversation.
Yeah, the time got away from us. I don't know if we had any questions from the community.
I followed my boss across the street, and she says the only question was, is dark chocolate better than the white chocolate? I'd say yes. That's about it. But thank you all.
Thank you for having us.
Thank you.
Our friends over at Doctors Hospital. So stay tuned for Dr. Day.
From boat days to beach gatherings, leave the catering to Subway. Choose from small and large sandwich platters, double meat wrap platters, and top it off with optional cookie platters for dessert. Or ask about our Subway box to go with the option of 6-inch or foot-long sandwich, 1 cookie, and 1 bag of chips. For all occasions and celebrations, let Subway focus on the food so you can focus on the fun. Visit subway.ky for catering options. Subway. Eat fresh.
At Doctors Hospital, we know life happens, and usually when you least expect it. So when unexpected medical issues arise, you need quality care close to home. Located in the heart of Georgetown, our accomplished team of physicians and medical staff treat minor urgent conditions such as migraines, chest and abdominal pain, shortness of breath, burns, broken bones, open wounds, and more. 24 hours, 7 days a week with no appointment necessary. Peace of mind is important when life happens. At Doctors Hospital, we're always here just for you. Need to speak to someone? Call 949-6066.
Find your dream car with a Cayman National Vehicle Loan. Enjoy 100% financing, up to 8-year repayment, and a 7% fixed interest rate for the first 5 years. For eco-friendly cars, we'll waive your commitment fee. This only applies to new vehicles. Call 949-8300 or email lending@caymannational.com today.
You know, as a little girl, I dreamt of traveling to faraway places and foreign lands. I tell you what though, no more dreaming. I'm going flying with Cayman Airways. How blessed are we in the Cayman Islands to have a very own national airline? Girl, you can fly to so many international destinations without the hassle of connecting flights. On top of Jamaica, Cuba, and Honduras, you got non-stop flights from Cayman to New York, Miami, Tampa, and even Denver, Los Angeles, Panama, and child, they now have Barbados. Going to be a little cafe con leche and Hollywood Squares for this old gal.
Make your travel dreams come true with Cayman Airways, offering non-stop flights for non-stop adventures in Panama, LA, and many more places in between. For details and to book, call 949-2311, contact a travel agent, or visit CaymanAirways.com.
Cayman Turtle Center is doing it again. Get ready to crawl, walk, or run. Lace up your sneakers and join us as we stride for conservation on March 17th at the 4th Annual Turtle Crawl 5K Walk Run, hosted by the Cayman Turtle Center. For just $25, you can be a part of this incredible event with every step you take supporting the conservation efforts for the majestic green sea turtles of the Cayman Islands. Sign up today at turtlecrawl.ky and secure your spot in this unforgettable experience. We extend a huge thank you to our amazing sponsors: Advanced Fire and Plumbing, CG Britke, CUC, Gatorade, DMS Broadcasting, Blue Water Medical Supplies, Yanni's Photography, Double M Distribution, Corporate Electric, Cryo 345, and Radio Cayman. Join us bright and early on Sunday, March 17th at 6:30 a.m. at the Cayman Turtle Center. Register now and don't miss out on the fun.
The Ministry of Education invites eligible Caymanians to apply for a local scholarship for the 2024-2025 academic year. To apply for a local scholarship or learn more about the various scholarship offerings, please visit the Scholarship Secretariat Unit's website at www.moescholarships.gov.ky. Applications close on Tuesday, 30th of April, 2024. This message is brought to you by the Ministry of Education.
Ladies and gentlemen, have you heard the news? Digicel is back with exciting offers that are too good to resist. Activate one of our brand new prepaid or postpaid plans today and experience telecommunications like never before. With more data, dedicated entertainment options like Netflix, YouTube, Spotify, and endless social text data for all your favorite platforms. Digicel is here to make sure you stay connected and entertained. Whether you are on a prepaid or postpaid, you will also enjoy dedicated roaming data for the USA, Canada, and the Caribbean. It's all about value, and Digicel has got you covered.
Radio Cayman's Talk Today. What is on your mind, Cayman?
Hey, welcome back. And I know what you're thinking. You're saying, this guy got a chance to start off talking to students about education. He got health care. Now it's education again. Man, he must be in heaven. Well, I think there are the two pillars in any society: a strong, robust healthcare system and equally strong, robust education system. So from the Department of Education Services, our customer service manager, Ms. Kimberly Kirkconnell, joins us. And I know it's, for me, good that there was a realization very early on that school days are the best days of your life.
They absolutely are.
And I'm mindful that sometimes as a student, we don't always appreciate that, you know. But when your friends who are educators have a choice between working somewhere and making tons and tons of money, if that is not their primary focus, they want to remain in the classroom. Now, I'm not to say that we shouldn't pay and reward our teachers and hold them accountable, but that's a different story for tomorrow's topic. No, just kidding. But welcome and thank you.
Thank you for having me.
Today is, well, it's a leap year, so I don't know if it's the 29th of February or if it's, well, only the 29th of February because it's a leap year. But I know it's February, presumably.
Yep, still there.
But school, the next school term, is it like August and September? So why are we talking about school registration? So through you, we'll find out.
That's right. So education, registration for education and for our government schools is a very detailed, very complex process, and that's why we launch it early. And for government schools, our registration is opening tomorrow, the 1st of March, and that is for all government entries coming in August 2024. So we are already preparing for the next academic year. We are already trying to get everything settled and sorted so that hopefully by summertime, families will know where their kids are going and everyone will have a smooth transition into the system come August.
You know, and that's the thing, as you shared, a smooth transition, because whether it's the student entering for the first time, whether that student is moving from one school to the next, there's excitement. It could be a little bit of trepidation, a little bit of nervousness, but even if it's, finally going into that school, we want to be able to ensure that that process takes, as little effort, energy, and, nerves. But we got to start somewhere, right?
Absolutely. And, we do require quite a significant amount of documentation. And, we're not requiring it just for the sake of requiring it. We really do need it to help process and to make sure that, we have the right child, we have the right parents connected to that child, we know exactly where they need to go, where they're living to determine catchment. So, it is a lengthy process and sometimes it can get frustrating. And I fully appreciate that. And so, hopefully today we can talk a little bit about putting everything together and help parents to make it as easy as possible.
Well, they say information is key. They say that education is both, empowering and equalizing. They say information is powerful, but sometimes we don't access the information that is there. When we get it, we don't process it. So we're very, very grateful. And sharing that, yes, today's the end of February as we know it for this year. Registration opens tomorrow.
Yes.
School will start, for the new academic school year, in short order. Summer to be excited, expected, enjoyed. But in the time, there's a lot of things to be done.
Yes.
So help us to ask the right questions, help us to have all the answers. But one, if I might start, you use the word catchment in the catchment area.
Yes.
Maybe some of us know what it is. give us a proper understanding of how that works and why that's important.
Yeah. So basically, every government school, the population is determined by the catchment. So that is the area in which you live in. It doesn't fully align with, your voting districts or anything like that. We have a catchment map on our website. Go take a look at it. Most parents are very good at knowing exactly which school is for them. So that is, the geographical area that determines your child, which school they go to. So, the high schools are simple. Clifton Hunter's all our eastern districts, from Savannah up to East End, and John Gray is from Red Bay to West Bay. And then, each of our primary schools are then more smaller catchments based on the district that they're in.
And Georgetown, we have more primary schools relative to West Bay that has one.
Yes.
So if you live in West Bay, you got to know, well, do you fall in that catchment? You may consider yourself not living in West Bay, but when you look at the catchment area, that's where you fall.
Yeah, exactly.
So you may want to go to a particular school, but if you live in a particular area,
that's right.
If it's a government school, that's where you're going to be directed to.
Yes.
Okay. Seems reasonable and understandable, but thank you for clarifying.
No problem.
And that would be determining where you live and you spend most of your, I guess, sleeps.
Yep. At least, morning and night. And so, as part of that, we ask for 2 proofs of address to confirm your living area, to make sure that we are assigning you to the right school. And it can get tricky, especially where some of the lines cross and some of the boundaries are, so we want to make sure that we are assigning children to the correct school.
I don't want to belabor it. I certainly don't want to, make it any more complicated, but I can imagine a household is listening now and think, well, the child spends a portion of time here with this parent or this grandparent, but a portion of time, with the other parent or grandparent. Just make it easier. East End to West Bay, for instance, which catchment area, or even if it's in Georgetown, but is it Prospect Primary, Red Bay Primary? Is it, the Marine? Miss Marie Primary School, Marine Park, which one? So in that case, I guess they could seek guidance through your offices.
Yep, they can call us and speak to us. I mean, we try and state it's where the child spends most of their living time, right? And we understand that families are complex and diverse, and some are split, which so then we would speak to the families about where's more appropriate. But and I think that kind of segues in, that. Again, we do have diverse situations. Some situations are not easy. And I just want to say, when we ask for more information or clarity, we're not trying to get into your business for the sake of getting into your business. It's really because we need to figure this out to make sure that, all the legal requirements are there, those who have custody, that's respected. So, we ask for patience and understanding, and, the team is very good at trying to explain that. But, we are asking because we have to, not because we want to.
All right. And this is where, we start the process now, go through the requirements. By the time school starts, that sort of opening day jitters can almost, be mitigated.
Yes. And we try and make sure that is, no one's left behind, and unfortunately we have had delays, and that's the reality sometimes of the situation, but we do try and get most sorted so that families can prepare themselves and give themselves enough time to start their new school.
Right. Well, we're going to continue chatting as long as Ms. Susan tells us, we take the break when she tells us.
No problem.
But as we speak to Ms. Kimberly Kirkconnell, the customer service manager over the Department of Education Services, and with school registration tomorrow, registration begins.
Yep.
Is this an in-person thing? Can we do it online?
All online. So we don't accept physical forms anymore. We have an online system that helps us manage all the applications. Everything can be found on our website, schools.edu.ky. The registration section is there, and you fill out your form. We'll have the list of, the documents you need. So please make sure you take a read of that before. Many people have called us, and we have a little brochure that we hand out. And so all information is there for you to get it prepared. And, also a plea, please don't wait till last minute. The standard registration period does close on the 30th of June, but it is a first come, first serve based on our priority list. And so please do not wait till the last minute. get your applications in early.
Okay, so when we come back from the break, we want to ask a number of things, including, the steps and the whole application process, and like you reference the priority list. But are we talking only for the government schools? This process?
Yes, this is strictly only for government schools. Private schools have their own enrollment requirements.
Okay.
We are just talking government.
So if you're in a private school now and you're planning to go across to one of the government schools, this is for you.
Yes.
If you're not in school now and you're going to go starting in the government schools, this is for you.
Correct.
If you're in a government school now, but you're moving from, say, primary to high, this applies to you as well?
Nope.
Okay.
So you're already, your spot is guaranteed, and that's a separate process,
Right.
so you don't have to worry about this one.
See, ask the right questions, you get the right answers.
There you go.
Please join us right after the break. Ms. Kimberly Kirkconnell is going to give us all the answers. 2 o'clock after the headline news, we get a chance. Ms. Kim will stay with us?
I'm still with you.
She's going to stay with us, but Ms. Jenny will join us, and we can talk about NCFA, but that's 2 o'clock, 30 minutes away. So stay tuned for Talk Today.
From boat days to beach gatherings, leave the catering to Subway. Choose from small and large sandwich platters, double meat wrap platters, and top it off with optional cookie platters for dessert. Or ask about our Subway box to go with the option of 6-inch or foot-long sandwich, 1 cookie, and 1 bag of chips. For all occasions and celebrations, let Subway focus on the food so you can focus on the fun. Visit subway.ky for catering options. Subway. Eat fresh.
Did you know that natural gas produces 40% less carbon dioxide than diesel? The conversion to use natural gas will help CUC get one step closer to our goal of 60% less carbon emissions by 2030. Learn more about how CUC plans to introduce this type of cleaner energy at www.cuc-cayman.com. With CUC, you've got the power.
The best foundation you can wear is glowing, healthy skin. The offices of dermatologist Dr. Wayne Porter specialize in enhancing your skin's well-being. Whether you're seeking advanced skin care, including any skin cancers, Botox, filler, cosmetic skin enhancements, or simply looking to reduce wrinkles, Dr. Porter offers a full-service dermatology and dermatological surgery practice. For more information, email drportercayman@gmail.com or call 946-9020. That is 946-9020.
You don't sound too good there, Bobo.
Yeah, you know how it is. With the kids back in school, every other week they coming out with something, and then I catch it.
Sound like it gets you. But for real, brother, flu season is here and COVID is still around. You gotta stock up on things like medicine, vitamins, and minerals for you and the kids. You know what they say, prevention is better than cure.
At ValueMed, our pharmacists can help manage flu symptoms and provide guidance on vitamins and minerals to best support you and your family's overall health. Visit ValueMed Pharmacy on Walkers Road or Town, or WhatsApp your questions and prescription refills to ValueMed on Walkers Road at 926-1662 or WhatsApp ValueMed in Town at 916-5511. Live happy, live healthy with ValueMed Pharmacy.
Hello, my beautiful Caymanian women. I'm Eliane Powry, your Miss Universe Cayman Islands 2023. Ladies, are you ready to embark on an extraordinary adventure? Recruitment is now open for women 18 and older, married, or with children. But hurry, our deadline for applications is March the 8th. Don't miss out on the chance of a lifetime. Explore a world of opportunities that await you. Visit MissCaymanIslandsUniverse.com to begin your journey today. Trust me, it's a journey you won't want to miss.
Radio Cayman's Talk Today. What is on your mind, Cayman?
Hey, welcome back, and thanks for joining us. And as we talk about school registration, which starts, I could almost say in hours, official opens, the customer service manager over at the Department of Education Services, Ms. Kimberly Kirkconnell, joins us. All right, so we asked a couple of things before the break. We're going to recap some of the things, but talk to us, Ms. Kim. I mean, everything has a process, and there's quote-unquote paperwork. There's documentation that needs to be provided. All right, what sort of documentation? What's the process like? What do we need to do to get our children registered? Who are we talking about? What ages and where?
All right. So I'll walk you through the process a little bit.
Hold my hand, please.
Yeah. So on our website, again, schools.edu.ky, you will find the online application form when it launches. And you go and you essentially just take yourself through the form. So it's going to ask for your child's legal name, their age, your address, the primary parents' information, secondary parents' information, and so on. And then there's also going to be evidence that you need and documents you need to upload to the form. So that includes your child's birth certificate, that includes their immunization records, proof of immigration status, because that determines our priority list, and that comes in many different forms. We need 2 proofs of address, so your home address, so that's in the form of a utility bill, your government ID with your address, and so on. Your proof of relationship or guardianship to a student. So if anyone is adopted or has a court order, we need to see those as well. Photo ID for both parents. If your child has any special educational needs, we're going to ask you to identify that. And if they have any formal assessments, we're going to need a copy of that because that helps us determine the support when they enter our system. And that's the general list. So there's lots of different finer things to those lists, but those are essentially what you need to put together. And the team is very good. When we see if anything's missing or any misunderstandings, we will come back to you. We'll check it off. We'll say this is missing and so on. And, one of the touchiest things, of course, is proof of you being Caymanian, right? And we do ask for the work acknowledgement letter. And, we appreciate most of us in the unit are Caymanian. We understand the sensitivities of having to prove yourself in your own country. But unfortunately, that is the way it is, and that's what's recognized. So if you don't have a status letter, we do need the work acknowledgement letter. Most parents are very good about it, and they know it is about a 2-week process. So if you haven't gotten that yet, please go and get it. You don't have to wait on submitting the application. You can just upload a document that says, I've submitted it, or send us the cover letter confirming that work has received it. So that doesn't delay too much. And then, we ask for other evidence of immigration status for non-Caymanians as well. And I think that's a thing to say, that we do accept non-Caymanians into the government system, but it is pending space, right? So Caymanian children are always placed first, refugee and asylum seekers. Then we accept dependents of Caymanians. So those are children where mom or dad may be married to a Caymanian, children who are adopted by Caymanian parents, those where the parents have received status, but the child may not have received status yet. And then after dependents of Caymanians are government workers, so civil servants, those families with permanent residence, and then our work permit holders. So again, everything after dependents of Caymanians is pending space, and there is not a guarantee that you will get in, but you can certainly put an application in and try.
Okay. And I would imagine then that requirements that work to satisfy, proof of being Caymanian, the parents, the family should speak to work, satisfy. Yes. They'll tell us what you needed.
Exactly.
And once that is done, your department then can take the form. Yep. So we're not going to answer those questions here, but that's the process. So upload that form, have that little attachment, and pending the formal confirmation from work, but the application can proceed.
Yes.
Okay. Any fees involved?
So not for Caymanian children, but any non-Caymanian child, even those who are dependent of Caymanian, because those children are not legally recognized as Caymanian yet, have to pay fees. The fees are termly fees, and let me check my list to make sure I quote it right. So for primary school, so this would be reception to year 6 or nursery to year 6 in some, it's $250 a term. Lower secondary, so that's years 7 to 9, is $300 a term. And your years 10 to 12, upper secondary, is $400 a term.
Okay. Payable, to the Department of Education Services?
No, actually, it's paid through Treasury at the government building. So our Ministry of Education will invoice parents, and then they have to go pay at Treasury. Okay.
And we said we were only talking about registration for government schools.
Yes, government only.
Yeah. Would that be helpful to, you got the schools, primary and the high schools, throughout the districts on all 3 islands?
Yes, so this is everybody. So in Cayman Brac, we run nursery all the way up to year 12, and that's because it's only government schools in Cayman Brac. So we allow non-Caymanian children in nursery and reception as well. In Grand Cayman, we have a nursery program right now at East End Primary School, and that caters to children that live both in Northside and East End. That hasn't expanded yet. There's a reception class or reception program in all Grand Cayman government primary schools, but reception and nursery are for Caymanian children only. And that's because it's non-compulsory. And so we only accept Caymanian children into those programs. Dependents of Caymanians, asylum seekers, and non-Caymanian children can enter from year 1 and go up.
Now let's talk about the ages. I mean, you reference year 1 and then even prior to that, the reception. So the compulsory ages first. What ages are we talking about?
Yeah, so compulsory age is 5 years old before the 1st of September of that school year. And this is where we always get into a bit of confusion, especially, you know, if your children are a summer baby or they're in that September bracket. Unfortunately, we have to have a cutoff somewhere. It's a legal cutoff in the Education Act. So it's the 5 years old by the 1st of September. Your child must be in compulsory education. So that's either a government school, a private school, or you can also register through us to do homeschooling.
Okay. So compulsory from the 1st of September. So if your child's going to be 5 in October,
you are not considered compulsory under the age, and you will wait the following year. So if you're a Caymanian child, you can apply for our reception program because we take in from 4-year-olds, nurseries from 3. Everyone is on that 1st of September cutoff. And then compulsory goes right up until either the child has graduated from high school or they turn 17 years old.
Okay. Now, as you shared, it's all online. 1st of March is tomorrow.
Yep, tomorrow it starts.
My calendar didn't recognize a leap year, so I was today. But no, from tomorrow. And it continues through to when?
The 30th of June. So that's the standard registration period. We're not going to formally close the portal. So we'll still accept applications on that. But then you are going to be waiting. So we are going to be processing all the standard registration applications first, those who will be considered first. And then we will deal with late registration applications after. And again, you know, I understand the possible frustrations that come with that, but we have to cut off to prepare for the next academic year. And so again, you know, we've got March, April, May, June, 4 solid months. Please, please, please get in your applications. Do not wait to the last minute.
4 months. You know, I know things that take shorter, but let's do it. We're going to take the news break in a second. I know you're going to remain with us as you join our colleague to talk about NCFA, but anything else you want to share now and recapping the school registration, or if not, during the conversation later on?
Yeah. No, I think we're good. Just a reminder.
Hey, listen, I say this with the greatest, not only of pride and respect, but absolute confidence as we talk about our stellar civil servants, Miss Kimberly, and when Miss Jenny joins us, you can see why. Okay, we'll pause. We're going to take the break for news, and when we come back, we'll continue the discussion. This time we'll focus on the NCFA. So stay tuned for Talk Today.
Radio station. Radio Cayman is the voice of the Cayman Islands. www.radiocayman.gov.ky. Check out our social media pages: Facebook, YouTube, X, formerly Twitter, Radio Cayman Headline News.
Water Authority Cayman is inviting the public to join them for the official grand opening of its Cayman Brac Customer Service Office on Friday, March 8th. The grand opening will begin with an official program at 10 a.m. Customers who apply for piped water service or a new customer portal account that day will be entered into a raffle to win various prizes, including a new phone and Water Authority gift certificates. Visitors will also be able to enjoy refreshments during the event. Good afternoon once again. I'm Dion Anglin with your headlines in news elsewhere. A rapidly spreading Texas wildfire has killed one person, forced residents to evacuate, cut off power to homes and businesses, and briefly paused operations at a nuclear facility. It has burned 1.1 million acres north of the city of Amarillo, making it the second largest fire in U.S. history. Texas Governor Greg Abbott issued a disaster declaration for 60 counties. Dry grass, high temperatures, and strong winds have fueled the blaze, which remains 3% contained.
and Hillsborough County Sheriff's Office has shared footage of the joyful moment a missing 5-year-old girl was found in swampy woodland in Florida. She was spotted using a thermal imaging camera, and deputies were sent to her location, reaching her less than an hour after she was reported missing. The youngster, who is autistic, had wandered from her home. She was found uninjured approximately half a mile away. That's a wrap of your headlines. I'm Dion Anglin.
More news available at www.radiocayman.gov.ky. Check out our social media pages: Facebook, YouTube, X, formerly Twitter, Radio Cayman Headline News.
At Doctors Hospital, we know life happens, and usually when you least expect it. So when unexpected medical issues arise, you need quality care close to home. Located in the heart of Georgetown, our accomplished team of physicians and medical staff treat minor urgent conditions such as migraines, chest and abdominal pain, shortness of breath, burns, broken bones, open wounds, and more. 24 hours, 7 days a week with no appointment necessary. Peace of mind is important when life happens. At Doctors Hospital, we're always here just for you. Need to speak to someone? Call 949-6066.
Ladies and gentlemen, have you heard the news? Digicel is back with exciting offers that are too good to resist. Activate one of our brand new prepaid or postpaid plans today and experience telecommunications like never before. With more data, dedicated entertainment options like Netflix, YouTube, Spotify, and endless social text data for all your favorite platforms. Digicel is here to make sure you stay connected and entertained. Whether you are on a prepaid or postpaid, you will also enjoy dedicated roaming data for the USA, Canada, and the Caribbean. It's all about value, and Digicel has got you covered.
Freedom, Cayman Rack. Freedom, Little Cayman. Soft breezes, blue waters, no traffic. Unwind and rejuvenate your mind, body, and soul. Sister Island Staycations, a taste of freedom. Discover all that our sister islands have to offer.
You know, as a little girl, I dreamt of traveling to faraway places and foreign lands. I tell you what though, no more dreaming. I'm going flying with Cayman Airways. How blessed are we in the Cayman Islands to have a very own national airline? Girl, you can fly to so many international destinations without the hassle of connecting flights. On top of Jamaica, Cuba, and Honduras, you got non-stop flights from Cayman to New York, Miami, Tampa, and even Denver, Los Angeles, Panama, and child, they now have Barbados. Going to be a little cafe con leche and Hollywood Squares for this old gal.
Make your travel dreams come true with Cayman Airways, offering non-stop flights for non-stop adventures in Panama, LA, and many more places in between. For details and to book, call 949-2311, contact a travel agent, or visit CaymanAirways.com.
Discover your dream home with Cayman National's home loan. Get up to 95% financing, repayment up to 40 years, and just a 0.5% commitment fee. Your interest rate? Depending on your risk factors, it'll be fixed or variable. Plus, you get a pre-approved credit card. This is a limited time offer. Dial 949-8300 or email lending@caymannational.com today.
Radio Cayman's Talk Today. What is on your mind, Cayman?
You see the magic of video and camera? Well, if you were joining us just before the break and now you come back and go, wait a minute, now there's three. Well, when there's good people assemble, what is it the scripture says? Where there are two or more, there I am.
Mm-hmm.
So joining us now is Ms. Jenny Rivers, the Head of Business Services over at the Department of Education Services, and her colleague, the Senior Customer Service Manager, Ms. Kimberly Kirkconnell. We're talking about school registration early, and if I slip back and ask questions,
No
guide
worries.
me. If you remember something, Ms. Kimberly, you want to add?
Sure,
Because
thank you.
we want our community to be aware and involved and informed and, know that they're supported.
Mm.
But we get a chance now to focus on the NCFA, National Children
Festival of the Arts.
Of the Arts. I think I remember the first year. I was so excited. I wasn't performing, by the way. Maybe that's why I was
I don't know if
excited.
you remember the first year because we're in the for the first year now?
So I remember the first year. Do the math. I thank you for looking at me and saying, but he can't remember that because I know I look young, like my daddy. But I remember that.
I'm trying to tell people that we all, both of us are young.
No. We are young. We are young. We look young. We feel young. We'll always be forever young, right? That's a song by Rod Stewart. But I remember that because there was that nervousness among some of us because we thought that we had to be a part of it. It was almost, as a child, you almost felt like you were being forced. Not understanding that the teachers were trying to encourage you at a particular talent. There were some who were, were good at, I guess today we do oratorial, but they're good at reading. They could, do recitation. Then there were some who were musically inclined and they were writing stuff. And the school wanted to push you on. This was the first year.
Yeah.
Do you remember, Miss Jenny?
Yes, I do.
You do?
I do.
Did you participate?
Yes, I did.
And what did you do?
I sang with a choir.
The choir.
Not that I wanted to, but like you said,
Yeah.
it was something that we did as a class and as a community.
Yeah.
And it started the pride in your culture.
Yeah.
Because it was a cultural thing.
Yeah.
And we have developed that over the years. And I think this year we're pushing culture even more.
Yeah. I mean, I was sharing with Miss Norma. I remember this, right? Assuming I was, truthful. And she said, well, not to do it's not a competition, but she could remember when Noah was building the ark. Man, she hears that today. So we're young compared to that. But the beauty, 41 years, and to see what it's become. And I always enjoy certain parts with more than others, like anything.
Yeah.
The American football match that they have once a year. The commercials used to be my favorite part. And of course, the food that my sisters would prepare. That was even better. But there are things that you just enjoy. If you're watching football, real football, you want to see the free kick more than anything else, not even the penalties. But with NCFA, almost all of it, I'm trying to think, is there one piece I don't enjoy? All of it is just fantastic.
Yeah, it's wonderful.
It is amazing. I just wish it was something as...
And a talent that...
Yeah.
The talent that is in the Cayman Islands, and a lot of people do not realize the talent that we have in our young people, and this is a place to promote it.
Yeah. We can harness it. We can showcase it. We can identify it so much easier because there's only 100,000 people. Some of us worked with companies that had 10 times that employees globally, and you got lost easily. But 100,000 people, 5,000 elderly people, you can find each other. Would you help us though to not just an overview of the can I call it competition? The festival. Give us a perspective. For those who are just joining us, we have both Ms. Jenny Rivers and Ms. Kimberly Kirkconnell as we talk about the national, sort of children's festival of the arts. In its title alone, it's invigorating. It's a festival.
Yep. It is. It's an absolute celebration of our young people's talents, and it does focus on the arts. So the main categories are dance, drama, music, speech. We do also have an art showcase, which is your more, standard creative art, and that we're doing that a little bit differently this year. We're not doing that as a competition. We're going to let schools kind of submit what they feel is their best. The National Gallery is going to support, and we're going to do a digital display this year. And that, will be great in terms of access and who can see it and posting online. So there's more information coming up on that in the coming weeks. And then, of course, the actual competitions per se is dance, drama, music, speech. And the competition, and I'll quote Miss Stephanie Williams, who's still very much involved, and it's an absolute pleasure to have her support still. She says it's really a competition kind of against yourselves in a way.
Yeah.
It's not, who's the best of each category. You grade that because there is gold, silver, and bronze, and you do get scored, but it's not like you're the best of the best. It's competing against yourself to see how well you can achieve. And so, there is scoring. And this year we've actually added a little bit extra, and it came out of a performance from last year, that there is the potential for a platinum for those absolutely exceptional performances that, you know, the adjudicators feel deserve to go beyond the 100 points that have just blown them out the water, to recognize, you know, those talents. So we don't expect those to be handed out easily, but we have allowed for that category this year. And the festival is open to all schools, government and private, and homeschool children. And again, it's one of those wonderful programs that brings the education community together. You know, we want the mixing of the kids. We want kids to meet new people and friends from other schools and organizations. And the other thing we've put in this year is we're not just allowing students to register through their academic school, but also through their, you know, potential music school and so on. So if they receive extracurricular outside the school system, they can register through those, you know, private music and dance companies as well.
And unlike earlier when we were discussing school registration for government schools, the NCFA
for everyone,
all of our students. Now, is there an age, because with school registration compulsory age 5 to 17, we also have tertiary institutions, we have UCCA. Are these
So we've kept it for students. So it does align with the compulsory school age. So this is a competition for 5 to 17-year-olds as well.
Right. And I like what Ms. Jenny was saying earlier, and to listen to how Ms. Kim said it, you know, dance, drama, music, speech, almost sounds like a song. I mean, I say it's dance and it's drama and it's music and speech, but Ms. Kim, I can put a beat to it.
Well, there you go. I mean, maybe someone, and you know, the beautiful thing about NCFA too is it allows for individual compositions and music writing and songwriting and stuff, and there's open categories. And you know, we've gotten a few already for next week, which is all of our high school competitions, who they're composed by the students or a music teacher. And you know, that's what we want to see as well. We want to see creativity come out and let kids showcase their own work.
So as you shared, not only can it be an original compilation, a drama piece, a dance that's been choreographed by the school, the teacher, the students, it can also be something that, you know, maybe a classic, that child is a poetry recitation, and they put their own spin on it. And you're right, you know, that.
Because in our speech category, we give them samples of ideas of poetry pieces, maybe by some of our, like Nasaria Sakoshalat and those local people, James Watler and those people like that. We give them, they can pick from those. We trying to push more Caymanian pieces.
Dilbert's
instead of the Caribbean. This year we going to try to push more Caymanian.
Yeah.
Like our own culture into it, our own Caymanian pieces into it.
And thanks for highlighting that, because I think what that did, as you referenced some of the poets, it may cause more of us who have an interest into, say, poetry, for instance, to not only just do it for our own private edification and the like, we get it published. It becomes a body of work.
And it might be said at NCFA
and it might
one
be.
year.
There we go. And I'll put a call out now too. You know, we are looking to develop, especially our speech bank and so on, and we want local artists. So if there are any local artists who, you know, be willing to share their work that's published, that you know, for our children to learn and to speak, please, you know, send it in to us, contact us, because we'd love to add that.
No, it is amazing. You mentioned Nasaria Sakoshalat, and she did a couple of sort of evenings out at the National Gallery, where she had a local sort of poets assemble, and I listened. And, you know, I can't call her young Miss Edie, but I know her father would say that she's young. To listen to her read original works inspired by her family, the other Caymanian poets there, it wasn't just the parlance. They referred to places. They talked about experiences. And I sat there, and as much as I think I like poetry, I chat with Leonard Dilbert often as a guest. You have something when it's your work, when you can talk about the conch shells and iron shore, walking through Bacchus and stepping into the periwinkles, or you can talk about under the mango tree, and it's you speaking to you. Wow, you know, it's good to have, you know, people quote Tennyson and, you know, read from D.H. Lawrence and the like, but that wasn't alive then. I don't necessarily know. Right?
Yeah, and we want to, you know, this year too, I mean, NCFA is a celebration of all cultures. We know
Right.
Cayman is multicultural, but we still want to remember and highlight our local culture and allow kids avenues to bring that through. So not only do we provide those sample, especially in poetry and music, and dance, we, promote the quadrille and so on. There's 2 categories that we've put specifically for Caymanian culture this year. So it's the Caymanian storytelling and the Caymanian dialect under speech. Because again, we want kids to learn, and and that can be learned by anyone. It doesn't have to be a Caymanian child, to learn. I'll use my sister as an example. She does a Caymanian. She's a teacher, and she
Yes.
does a Caymanian word of the week.
Yep.
And her, children in her class are from all over the world, and so every week they're learning a new Caymanian word and the meaning to it and how to say it properly. And those are the kind of things we want to highlight.
Thank you. What is interesting, this is where I appreciate my parents, but my father in particular, like the seafarers of the day. They've traveled the globe, and maybe consciously. I don't know that it was done that way, but I want to say so. They saw things, they came back and they shared with you, and you took it on board. Instead of they shared it in a Cayman context, we want our children to be as best equipped as possible.
Yep.
Their language skills, they learn other languages, they become proficient in whatever software, whatever new career opportunities. But in so doing, are we displacing, unconsciously, our dialect, nuances, or even our vernacular? Look at our architecture. And there are some words that we don't use, and it's only when we hear it that we go, oh, you haven't heard that in a long time, right? And it's nothing. And I should have to say that our friends who have, come from other places here, they too are cognizant of how they're losing not only their accents, but their connection to their own cultures. And to watch them sort of interact, those that don't have such a large percentage representation of our population as others, they're losing that. And in Cayman, we're losing it in Cayman. So I said to a friend the other day, seeing that behavior, that reminds me of a father. Like, huh? And, when we last said that, so I'm consciously trying to be reminded, and it's not easy. That's sad.
And I think, it's very much a, natural cultural phenomenon. You have your vocabulary when, your business vocabulary, your proper quote unquote vocabulary. And then you have the vocabulary you speak at home.
Yeah.
And there's nothing wrong with that. And I think, it's actually something to be recognized and celebrated. And, to not let go of that, and also important for our kids to recognize when it's appropriate to speak, properly, and when it's totally appropriate to let your accent.
This is their avenue.
Yes.
To bring it all out.
Right.
And I think every student, whether you're year 1 up, looks forward to this time of the year. And I was out visiting 2 schools today.
Sorry,
and
you were visiting or visiting?
Visiting.
I just checking, because I thought I was visiting. No, people laughing, but thank you, Ms. J.
I was out visiting 2 schools today, and that was the topic of conversation. The kids getting ready for NCFA.
Yeah, exactly.
My granddaughter comes home and said, we're singing One's a Boat in the Sound. She said, that's Papa's song.
Yeah.
Because her grandfather is a founding member of folk singers.
Oh.
So she listens to them all the time, and every time they're on the TV, she has to sit down and watch. So that was Papa's song. So it's bringing culture and to the whole island during this time. And at the end of it, we will also showcase. We do what we call final concert nights. That we showcase some of the best pieces that came out of this. And for the solos and stuff, we partner with Butterfield, and we do the Young Musician of the Year.
Yeah.
And we also do a steel pan competition as well. So it's culture all around.
Yeah. And this is where, as we grow as a nation, we celebrate all the wonderfulness that is here. We're mindful of the importance of not just protecting and preserving, but promoting what we are.
Yes.
I think many of us, and I say this carefully, but without apology, we confuse an accent, or you put on a twang. We confuse that with still being who you are. I'm a Caymanian true and true. I will conscious that one of the greatest joys I had was my daughter would give me alliterations with V's and W's, right? And she would get the biggest joke. And it's only after a while that I realized what she was doing. She picked up on it. that wine looked very good, eh? And it was just so beautiful. And here's this little thing, barely sitting in the chair. And she got that.
Yeah.
I owe her.
You don't think what you're saying. Somebody else picks up on it.
Yes.
But that is just part of growing up and part of your culture and part of your dialect and stuff. Going up and you heard someone else when you're younger saying it and you just picked up on it and.
But here's the danger though, and this is why I truly enjoy NCFA and why I commend. I say the courage that you have exhibited in trying to ensure that the Caymanianness is evident. Some would see and malign us for doing that. But if you can't, be the king of your castle if you're the only person paying the rent, where can you be the king of the castle? I mean, there might only be a shoebox, but it's your castle, right?
Mm-hmm.
So if in Cayman, if we don't know what we have, don't respect it, and don't showcase it, it'll be passed. Yeah. This is an opportune time. So as you introduce more of the Caymanianness and we are proud of it, we will appreciate how many people love it. Hope I'm not talking out of school, no pun intended. I celebrate Cayman, as you shared, with all the different cultures and nationalities that are here. And to have them share with me things about Cayman that I forgot that. Oh, I didn't realize that. Or I get to see the new through their lens. It's a beautiful thing. This is what NCFA can do for us at that student level.
Exactly. But you also, during this, you'll also see children from other cultures actually try to do a Caymanian piece. Yeah. And you'd be amazed at how well they do it.
Yes.
It mightn't be like what a Caymanian child would do it, but it's still, they tried it and it's a different perspective on it and they brought their own twist to it.
Right.
And that's what it's all about.
Yeah. I think what it also helps us to appreciate that they can see this thing. It's sort of like, it might not be the same for you as a parent, right? But your child goes over to their friend's house and they come back raving about the white rice that you cook all the time, how much better it was. Or how, when you call your friend up and say, oh, your son was over here, boy. So good to see a child
polished off the plate.
A child eats so well. He eats. When he's home, he doesn't eat anything.
Yeah.
Right? It's that sort of a similar thing. But by the same token, though, are we cognizant that if we don't do this, we don't embrace it, we didn't invite people to, at least be able to participate, we lose it. Is there a flip side that it's becoming, I won't even say consumed, but almost, cannibalized sometimes, the Caymanianness, because we don't have the pride or the courage and conviction to share it, because we've been told always, by our own homes. Boy, try to sound like you got sense. Well, I can try, but I mean, but it's not. It's that confidence. I get beat up sometimes. Boy, you a Westbay? Oh, yeah.
Yeah.
And it doesn't mean that you're not intelligible, but yet a person from somewhere else speaking in a way that it's not only the diction and the elocution, that their syntax and their grammar is absolutely incorrect, but they sound a certain way, and we think they're intelligent, but they're not. A mixed bag, isn't it, Miss Kim?
Yes, it is, and I think this is like I said, it's an avenue not just to promote Caymanian. We embrace all the cultures, but it brings, knowledge and respect, because when you learn more and you know more, you can grow more and be a better person. And so, and I think, and we see a good mix. We haven't been through all the entries for next week yet, but we are seeing a great mix of those Caymanian culture pieces coming through, which is so wonderful to see. And, hopefully maybe we'll get some new, brand new pieces that students have commended that we can then put in the festival going forward. And they're going to be new cultural pieces that we can enjoy.
So is it dance, drama, music, speech, dance, drama? I can't do it how you did it. But the dates and the participation, and I recognize the time, but this is so exciting, right? So we know school registration starts tomorrow. We know that ends on June the 30th. NCFA is for all students across all 3 islands in that sort of mandatory legal school age of 5 years old to 17.
Compulsory age kids.
But when is this starting? What do we do? I mean,
So next week, Monday the 4th to Wednesday the 6th is all of our high school competitions in Grand Cayman. And we've broken them up a little early to try and avoid too much of the exam time because we know it, especially for our upper kids, it gets very stressful. So the secondary competitions will be next week. And then primary will then start in April. And that starts the week of the 15th. Yep, 15th of April.
15th to 17th.
Yep, in Grand Cayman. And then we go over to Cayman Brac on Thursday and Friday, the 18th and 19th of April. Our Amin Mohammed Steel Band competition will be on the 20th of April. And Young Musician of the Year of the Ward will be on Monday, the 29th of April. Thanks, Miss Jenny. So it's a lot. And then our final nights will be that same week as Young Musician. And that's really the one for the public to come out to.
Ours will be, we have final concerts in Cayman for 3 nights, and then Cayman Brac has theirs on the Saturday night, and that will be the end of National Children Festival's Arts, will be the convention, will be the final night in Cayman Brac on the 4th. Yeah. And that will be Cayman Brac to showcase their pieces.
All right. And as you shared, we know the schools and the students have been, not just excitedly preparing, but many times as the parents, unless we are connected to the school or the wider public, we're not quite sure what's transpiring. We can see the final night, but can we see any of the other stuff?
So parents could come through. We don't, open up too much with the kids coming in and out. But if parents want to speak to their schools about coming to see their child's piece, we can certainly, make that happen wherever we're performing. So like dance is at the Harquail. There's a few of the competitions at John Gray. And schools will have the information that they can share with their parents. So like, for example, if you're coming through John Gray, you'll have to sign in and go through those procedures.
And then the primary, the choirs, because there's such big choirs coming out of primary schools. We have some of the primary school choirs are like 60 children. Yeah. We're actually going to have those in April. We're going to have one set's going to be at Cayman Islands Baptist Church, and then the other set is going to be at Red Bay Holiness Church.
Mm-hmm. Again, just speaks to the 4 decades of growth. In its first days, it was probably only a handful of students. Now we got thousands.
Oh yeah, I mean it's a big competition, and we've, like I said, we've made some big updates to the syllabus this year, trying to tighten things up, make things a little clearer. And I want to I'm not going to try and call everyone's name because I know I'll forget everyone, but they know who they are. We have a music committee, an organizing committee, a dance committee, speech and drama committee, and those are professionals in the field, teachers in our schools who have been absolutely amazing in supporting us with this, making it happen, seeing how we can improve it, and just a huge thank you to them.
Partners as well.
Yeah, and especially like Butterfield was called. We want CNB usually sponsors the steel pan competition, and so we really want to just thank everyone because it is a massive production. A lot of hard work goes into this to try and make it the best experience for our kids, and we just want to thank everyone very much.
And as you shared, you're sort of competing against it, although it's not a competition, the gold, the silver, and the bronze, and potentially an opportunity for a platinum, because we've seen some performances that exceed the score sheet. Given that, because we're going to be awarding the person or the group with gold, silver, or bronze, for one of a bit of education, I mean, somebody has to be judging it somehow. How is that handled?
So we have a database of amazing adjudicators, and again, they're coming from our schools, some of the private music and dance organizations, some long-standing, cultural community icons. So again, Miss Stephanie Williams, Miss Nasaria, Miss Marcia Mutu is going to be joining us. And so, we put that together, and they come out and they help judge. And the requirement is that we have 3 judges per competition. And we've had an overwhelming support from our adjudicators this year. And again, huge thanks to these people who are giving their time to, allow the children to perform and to, showcase their talents.
Well, I'm hoping that if there's a parent who either has not as yet had his or her child participate for some reason, would not only attend, but hearing this now would say, hey, next year, the child may.
Well, if they got a primary school student, primary school's registration hasn't closed yet for NCFA. It's just the high schools closed yesterday. We still got a primary still open.
Yeah.
Thanks for that. Yeah, I like it. The fact that we're not looking at excluding the child. It's not about pressuring, but about recognizing that hey, sometimes you may be in your own head telling yourself, "Oh, I can't." But if you watch the performances, you'll be motivated by it.
Oh, yeah. And ask your children, because you'd be surprised. Some children don't tell their parents. I remember my brother, who was very shy person, and my parents found out after the fact that he did a solo poem, and he hated stage, and he ended up doing it on the finals night. And they're like, you never told us. But he shone, and he did really well. And there's, other surprises out there. And so, ask your kids, see if the school is taking part, who's taking part, because, your child doesn't have to be in the art stream necessarily to compete and to for the school to put them in. We want kids to step out of their comfort zones too and try an opportunity.
And that's why Kim said this year that we open it up to the private institutions like the Spark, like the Center Point, like the Radiance Dance Studio, Cayman Music School.
Yeah, so they get a choice.
So we get a variety.
Yeah. You go in there for whatever, you're not excluded from it. You can participate with them or with your school or however, right?
Exactly, because not every school provides, say, dance instruction, right? And those are usually the extracurricular. So we didn't want kids to lose out in being able to perform because, they weren't able to access that through their academic school.
Well, I know we'll wrap up our discussion, but that brings me back to what Miss Jenny was saying, that the phenomenal talent that is here.
Oh, yeah.
I commend you for not just expand it to the Caymanians, but to all students, so that we get to see them, they get a chance to shine, and then as a community, we can celebrate. Here are these students, and if you've never been, you just watch them from a distance. It's good. All right. And now I know as we close out, I'm probably the only person that really doesn't care much for that other thing that's probably social media, but many people do. That's how they get their news, and that's how they know what's happening. I phone call people, but for those who want more, I know the NCFA has a sort of rebranded, new, fresh look, but where can we go to get stuff?
Oh yeah, so we want to thank GIS and the comms team and the ministry for helping give a fresh new look to NCFA this year. And there is a Instagram and Facebook page for NCFA, so do a little search and give us a follow, and we will be posting information and highlights and so on there. So keep a lookout for that.
But also make sure that you come out and support our final nights.
Yes, especially come and
and they'll be held at the Harkwell Theatre. So
and that's another huge partner, and definitely want to shout them out as well and thank them.
Well, if we can, either through your individual or collective appearance, or send us a piece and we remind our listeners, or you send out to your colleagues, we'll be more than happy, not just to showcase it, but to extend an invitation, a public invitation. This is remarkable. It's for all those students across all 3 islands, just showcasing their talent. So how we do it, Miss Dance.
I'm not going to be able to do it now. Dance, drama, music, speech.
Those are cute. I just thank you very much. Any closing thoughts, Miss Jen?
I just want to encourage, say to parents, if you know your child is interested in music, dance, anything, encourage them. This is an opportunity for them to grow, to learn, to show what they can do. Not every child is academic. This is somewhere that a child that is artistic can show their side, and come out and support the children, support our schools, especially at the final nights. We have 3 final nights in Cayman and 1 final night in the BRAC. We also have the Young Musician of the Year, which would be our elite. We're looking for up to 10, depending on the judging, up to 10 that finalists for the Young Musician of the Year. Then we have our steel pan competition, which will be on a Saturday night at John Gray Gym on the 20th of April. Come out and support the children, support our education system.
Yeah. Yep. Children, deserve not just our nurturing, and their safety, but sometimes our attendance, because it inspires them, and it's nothing probably worse than playing to an empty stadium. So if we're there in the audience,
it takes a village.
Yep. And we're calling on the village to come out and support.
Come on, bring your fish tea and sit and enjoy. Ladies, thanks very much.
Thanks so much for having
You're
us.
welcome. Thank you for having us.
I'm more inspired and more enthused about the wonderful society in which I find myself. So thank you all very much. Well,
Thank you.
Tomorrow's Friday.
Yep.
You know what that means, right? I mean, yesterday must have been Wednesday. So let's look forward to joining Mr. Art in the morning for the record and come back for Talk Today right after the midday news as we invite you to be a part of Talk Today. Until then, be blessed.
Talk Today is brought to you by Subway, open 24 hours in Countryside, Anderson Square in Georgetown, and Centennial Towers in West Bay. And by the Ministry of District Administration. Explore your history, explore your land, explore your sister islands. And Cayman Airways. Call them on 949-2311 to book your nonstop flights to Los Angeles and Panama. And now, Barbados. And Digicel, Cayman's bigger, better network. And Doctors Hospital. Peace of mind is important when life happens. Doctors Hospital, always there for you. Call 949-6066.